I'm Robert LeBoyer, Senior Biotechnology Analyst at Noble Capital Markets. Our next presentation comes from P3 Health Partners, a patient-centered health management company. With us here today is Dr. Eric Kaufman, who will give our presentation. Dr. Kaufman, please go ahead.
Thanks so much, Robert. It's a pleasure to spend some time with you today and talk about something I'm very passionate about in transforming care delivery in the United States. And I just want to start first by, of course, we have some forward-looking statements in here. Here's a few disclaimers. But as I think about the business of P3 as a whole, I just want to give a backdrop of what's happening in the rest of the country. As you look across the United States, you have roughly 10,000 senior patients are aging into Medicare every day. We have a primary care shortage of about 40,000 primary care clinicians anticipated by 2032. And we have a goal of getting everyone into value-based care on the senior side that's been put forward by Medicare by the year 2030. And those clinicians that are taking care of those patients have a burnout rate of 60%. And so we have a real lack of alignment. And our focus is in ensuring that we have alignment across the payer, provider, and patient in the healthcare ecosystem. So a bit about our company. We are physician-led. We are across 4 states. We care for 124,000 seniors across 24 counties. And we've got about 3,100 primary care clinicians in our network and take contracts from over 20 payers. One of the things I'm really proud about with P3 is their ability to influence clinical outcomes. And you can see that over the years, as we compare ourselves to others in our regions, we have demonstrably better results on things like inpatient admissions, skilled nursing facility stays, as well as ED admissions. And these are all really important indicators of how we can have impact to improve the care of the patient and the quality of their lives, as well as save dollars for the healthcare system in general. When I talked about our states, I just wanted to highlight within these states the geographies where we sit. So we have Arizona, which is one of our largest markets, followed by Nevada, where we have both employed groups as well as network assets. And then we have a presence in San Joaquin Valley in Northern California, and then Oregon, where we've grown considerably over the past few years. Now, one of the things I want to highlight with the geography is within these geographies, there's a lot of room for growth inside these geographies, and that will be one of our focuses as we move through 2025 into 2026. When we think about the problem that we're trying to solve, and I highlighted some of the things that we're facing with our healthcare system today, but this is a $3.8 trillion spend across all of healthcare. Medicare spend represents about $1 trillion. There's poor access for patients, and we're getting suboptimal care in aggregate across our healthcare system today. And we talked about the problem of physician burnout. So what I would say to you is that we're at a really critical inflection point in how we think about healthcare delivery in our United States. And we think we have our purpose of helping the payers get better quality, helping patients get better outcomes, and helping the providers have a longer, more fulfilling practice. So let me go a little bit deeper into what we think is our value-based flywheel. First, what do patients get out of this? I think first and foremost is they get better access to their primary care clinicians, and they get more personalized care plans because we're able to augment the practices with additional care management support, as well as data and analytics to help the clinicians better help the patients. And then we connect to services to help patients, for example, in the home, to allow them to get care where they are, rather than them having to come seek that care. When we think about providers, ultimately the providers get additional information that will help them improve the quality of care for their patients. They also have opportunities based on what their outcomes are for their patient populations to improve their financial position. And ultimately, what they're able to do is have a more healthy practice with better support. When we think about the benefits to payers, they have an alignment between the payment mechanism and what the outcomes need to be. We can improve their quality scores as well as help them grow. If you look at the history of P3, how did we get from 2017 to 2024? I think it's important to look at the growth trajectory that this company has had. It's been very impressive. And there hasn't really been a shortage of ability to expand the populations which we serve. You can see the graph showing the improvement in overall revenue from 2020 to 2023, sitting at 1.3 billion, and we're on track to hit our guidance marks between 145 and 1.5 billion in 2024. We have central functions that allow us to better care for these populations. And I think it's important to understand one of the differentiating factors for this business is we have delegation for utilization management, care management, and claims on portions of our population, which gives us early warning signs and indicators of what's happening with the patient population and allows us to have more prompt outreach to those patients. But for this business, profit has been elusive, and there's been a confluence of things happening in the Medicare industry that probably wouldn't have happened in this kind of a sequence in the history of what we've done. And what I mean by that is we had a few bad headwinds in this entire sector. The first was the pandemic and the post-pandemic utilization spikes that we're seeing now as patients couldn't get to care. We're now seeing them get to care, and a lot of the preventative services that would have happened in 2020, 2021, and 2022 have led to increased costs in things like oncology, just as an example. The second thing that happened is you had some regulatory changes that put pressure on funding for the health plans, and that was called the V28 to V24 to V28 model, in which CMS changed the way that reimbursement happens, and that's put pressure on overall revenues. And the third thing that happened is that plans created very rich benefit designs as they were trying to grow their health plans. And in doing so, that actually makes the cost of care go up. So those things have happened all within the last 4 to 5 years and put tremendous pressure. And what I'm happy to report is we're moving into a time now where that sector is getting some relief. And the way that's going to happen is multifocal, and we'll talk through that a little bit here in the next slide. So for our business, we have developed a turnaround plan that we've put together over the last 6 to 7 months since I arrived at P3 to serve as CEO. And that's broken down into a few buckets. Number one is we found opportunities to create operational efficiencies, eliminate redundancies, and find opportunities where we had services that were being duplicated and removing those from the business. The second is we had to go through and really look at the health of our contracts, both with payers as well as with the provider network. And we identified places where there was a mismatch between what we expected to get out of those contracts and what was actually happening. As a result, we've trimmed back some of the contracts that were losing considerable dollars, both payer-wise as well as with the network. And that, over the past years, accounted for about $35 million of losses for our business that we've now rationalized and now have a healthier portfolio than what we had previously. Lastly, we have a lot of opportunities around operational execution. And what we've identified are clear interventions that we can do as a team in the markets to be able to deliver an additional $70 million of EBITDA in 2025. And the way that's going to happen is multifocal. The big focus of the operational efficiencies was to find resources to be able to put more boots on the ground in the field to get into the doctor's offices as well as help with the patients, as well as some investments that we made in some technology to be able to improve our efficiencies overall. And we're very confident in the plan that we've laid forward. When I talked about some of the tailwinds, I wanted to highlight things that you may have heard from other parts of the marketplace, such as CVS, Humana, and Elevance, all of which corroborating the fact that they're going to start reducing the overall benefit load. We have some numbers to suggest what those benefit changes have been. As we get through open enrollment and identify exactly where those patients sit, we'll have a good idea of what the impact will be for 2025, but that hasn't been calculated quite yet. And this all comes down to team. And ultimately, we have built a strong, experienced team, including Leif Peterson, who is going to be on the call today for questions if we get to that point, as well as Bill Betterman as our Chief Operating Officer, and Amir Bacchus, our Chief Medical Officer. I'll turn it over to you, Robert.
Thank you for the presentation, Dr. Kaufman. One of the things that really struck me about the company is your points about this population segment and how this population differs from the typical adult population. And your point about physician burnout seems to be the culmination of some of these differences. Do you want to reiterate some of the differences you see and how your practice management accounts for those differences and serves the patients better and provides a more efficient delivery of the services?
Yeah, great question. Happy to comment on that. As I mentioned before, you have 10,000 new seniors that are entering Medicare every day. So it's a growing population. It's also where the majority of spend happens in healthcare. And there's a few areas that you look at. Senior patients have a lot more chronic conditions, which kind of makes sense. Sometimes you have to live through life for a period of time before those things develop. And ultimately, you're going to see about 90% of seniors have at least one chronic condition. And as you think about that, as those chronic conditions stack up, the ability for the patient to manage their complex care, whether they get hospitalized and have changes in medications, or they have multiple medications and may not know exactly how to take them all in the right way, or they may have barriers to transportation to be able to get in to see a clinician. This is a very specialized place in healthcare. And so we design interventions to allow us to do things to coordinate that care for the patient so that they get the right care, ensure that things like polypharmacy or pharmacy mistakes aren't happening for that patient population. We can actually deploy resources into the home of the patient to do things like safety evals, as well as actually deliver care in the home for the patient if that's the services that they need. And then ultimately, one of the big missing pieces is the communication back to the primary care clinician when those interventions are happening. And so really pulling that primary care clinician in as the quarterback for that patient and ensuring they have the information they need to guide the care is the key to the success in this business.
Yeah, that's great to hear. And just my own experience with friends, neighbors, parents, and their friends is that seniors are typically on numerous drugs. I've heard 8 to 10 as the average number of medications that most senior citizens are on, and coordinating the drug interactions and all of the prescribers seems to be one of the services that you're doing. And as you said, letting the primary care physician quarterback the care seems like a great solution in a population that has been ignored to date. So the other question is on your expansion and growth. You put in that for the 4 states that you're in and the territories. Could you just briefly outline what your expectations are for growth in the future?
Yeah, thanks so much. And I'll start it off by saying that we expect actually from 24 to 25 a slight retraction as we talked about the contracts that we let go with a few payers, as well as about 15% of the provider groups that we worked with. So we still have obviously the majority of the membership that we had previously, but we expect about 20,000 members to exit the organization in 2025 from that, and then we'll have some growth heading from 24 to 25. So I want to caveat it with that. To frame up why this business is in such a unique position, we have roughly 3,000 PCPs in the network. Those PCPs, if averages apply, care for about 2 million senior patients. And we only care for about 125,000 of those 2 million senior patients. So we have opportunities within our own practices to continue to grow with those clinicians by either expanding into ACO REACH, if they're not in the ACO REACH model, which is a part of our portfolio today, or to partner with other payers that those providers take and to get those members under the same contract umbrella. And so we have a lot of inherent growth there. We are interested in contiguous geography, and we do think that there will be lots of opportunities for us to build out our pipeline in 2025 for robust 2026 growth.
Great. And one of the things about healthcare is that different states have different programs and different regulations. it looks like you have a lot of room to expand within those states in adjacent geographies without crossing borders or encountering new regulatory burdens. Would you agree with that?
Yeah, and I think one of the things that protects us a bit, Robert, is this is a federal program. So unlike some commercial regulations or some Medicaid regulations, there's not as much state to state variability in terms of the delivery of the product itself and how that product is constructed and how the funding works. That really comes from a federal level. But there are some nuances state to state with licensing requirements whenever we have clinicians in those marketplaces. And certainly there are differences when you think about growth and M&A between the various states, and some have much heavier regulatory environments than others. But we feel good about the geographies where we are to be able to accomplish any and all growth that we need to.
Okay. And in terms of future milestones, are there any metrics that investors should be looking at or any particular milestones coming up that we can watch for to evaluate how the company is doing and how it's growing?
Yeah, I think, some of the things to look at are what were outlined in the turnaround plan. So in terms of our operating costs, that's something that people will be able to see an impact from the moves that we've made in the fourth quarter of 2024, impacting 2025 cash needs as well as operating expense. So that's one to look at. The second that I think is important is the percentage of seniors with chronic conditions. What our numbers suggest to us today is we have over 30% of the seniors do not have a documented chronic condition. Now, it doesn't make a lot of sense with all the things that we talked about previously and how many chronic conditions senior patients have. And typically what you see in a well-managed organization is about 10% of those patients would not have a chronic condition, meaning 90% of the patients have a chronic condition. And what happens there, Robert, is that if the patients don't have it documented in the exact right way, then it doesn't count towards a chronic condition. And so it's important for us to ensure that those patients are being thoroughly evaluated. And the way we accomplish that is we actually get tools in front of the clinician at the point of care to allow them to see that information that they couldn't see before to help them in caring for that patient. And so the chronic condition percentage is an important percentage to track. And we're at 70% of our patients have a chronic condition today, and we believe it should be closer to 90. And that's something that we'll be tracking along with everyone else as we implement our programmatics.
Yeah, I would agree that if 70% have chronic conditions, there's probably 20% that are underdiagnosed.
Yeah.
And whether it's diabetes or whatever it is, those are typically underdiagnosed and can be controlled for better outcomes. So by paying attention and diagnosing these things, the patients do better and the healthcare system saves money.
That's exactly right. And one of the things that I'd add to important metrics is, I would say, admissions to the hospital are always a good measure of how well we're preventing patients from getting sick and how we're taking care of them. And then, the other one, that comes to mind for me is, what our quality scores are. And so, what's the level of quality that we have with the services that are being provided, and how do we ensure that those patients are getting those care gaps closed?
That's an excellent point. And hospitalizations and total cost of care with those hospitalizations would be an important measure. Is it too early to determine what those things are for these populations, or is that something that you're yet to determine?
So in terms of the places where we think we have an opportunity for intervention to improve the overall total cost of care, one of them is around ensuring that patients get access to the benefits that are afforded them. A place that shows up is in palliative care, where we now have the opportunity to help connect patients to their benefits to receive additional services that they may not even be aware that they can have. And that does a couple things. It provides the patient and their family with resources and support that they need, that they didn't know that they could get. And at the same time, it tends to lower the overall cost of care because short of knowing what you can get to actually come into the home or help you in a different way, you may have to go out and seek through ER care and admissions to the hospital, even though you can get those services in a much more efficient and personalized way in the home.
Yeah, very good point. And the idea that you have both home care and clinical care is very important, especially for this population. Okay, are there any financial metrics that you would point us to as important measures going forward?
Yeah. Hey, Leif, do you want to give Robert some of your thoughts?
Yeah, Robert, appreciate the opportunity to answer that question. And as Eric kind of mentioned from a standpoint of the reorganization plan that we have in order to drive towards profitability and cash flow, one of those things obviously is around our operating expense costs, and so that would be an input that people will want to consider as they look at P3, as well as our medical margin. And medical margin is effectively a measure of how well are we managing medical costs compared to the cohort and the membership population that we have. And then finally, last but not least, would be adjusted EBITDA. And that is the measure that we draw on and report out on to the street as it relates to a proxy for our cash flows. And as Eric kind of talked about, we think we have about $130 million of opportunity moving forward, which would get us to a cash flow and positive adjusted EBITDA measurement. And then, as Eric also mentioned, we're going to contract in 25. The idea is let's get really good at what we're doing here and get our operating model really tightly wound. And then in 26, 27, we can look to take growth moving forward and expand upon what we're doing from a turnaround perspective.
Great. Okay, well, I have no further questions. I'd like to thank you, Leif and Dr. Kaufman, for joining us today, and look forward to following the company in those milestones going forward.
Thank you so much, and we appreciate the opportunity to tell our story. Thank you.
Thank you. Bye.
Bye-bye.
With more than 6,000 small and micro-cap companies listed, if you're looking for the next Apple, then ChannelCheck truly is the orchard. It's an investor community where you can access independent Wall Street research, advanced market data, balanced news, corporate videos, and podcasts. You can even register to attend in-person Meet the Management Series luncheons, and to be part of the preeminent annual Small and Microcap Investor Conference, NobleCon. And here's the best news. Since ChannelCheck is sponsored by the featured companies, premium membership requires no investment. It's absolutely free. So check it out. Log in today. Find out why ChannelCheck is North America's leading source of research on the companies that just may change the world.
Which might save costs for the healthcare system.